So how does someone know if they have COVID-19? Now we're going to talk about some laboratory tests that can be used to diagnose this disease. There are two kinds of laboratory tests you might hear about for COVID-19. One is a diagnostic test, and that test identifies virus that's in the body. It's called a PCR test, which stands for polymerase chain reaction. That's the chemical reaction that's done in the lab to look for the virus. It's also called a molecular test, and it gives us a sign that the virus is reproducing in your cells. Another kind of test is an antibody test. This test can identify antibodies to the virus, usually in your blood. Antibodies are made by your immune system to fight off viruses or bacteria. We can identify antibodies that are specific to this virus in your blood. Some antibodies, called IgG antibodies, begin to develop when you're sick, but they're identified mostly after you recover. Remember that no tests are perfect. This means that sometimes, despite our best efforts, the results from a test could be wrong. When we're looking for active infection, usually we do PCR tests on people who have current signs and symptoms of the disease. The PCR test detects the RNA of the virus, which means the genetic material of the virus. So this tells us, essentially, if the virus is in the body and replicating in the body. We usually take a swab from the nose, the throat, or the mouth, somewhere in our respiratory tract. Saliva can also be tested for the virus, but it's not commonly used. The reason we take samples from the respiratory tract is because that's where the virus likes to replicate in the body. If someone has a positive PCR test, that shows that there are particles of that virus in the sample that was taken. This means there's an active infection there. Sometimes there are false results, and that means that someone actually is infected with the virus, but their sample doesn't show that the virus is there. So not all people with the infection will have the viral RNA in their sample. This is important to keep in mind. Just because someone has a negative PCR test, that doesn't necessarily mean that they definitely don't have the infection. However, if someone does have a positive PCR test, then we can be very confident that they do have COVID-19. Sometimes we want to know if someone has had the infection in the past. An IgG antibody test is the most common antibody test used for this purpose. Our bodies usually start to produce IgG antibodies 10 to 14 days after we're infected. So they'll start to develop when we're sick, but we'll be better able to identify them after we've recovered. So these antibody tests can be performed after someone has already recovered from the infection, or in people who never had signs and symptoms, but want to know if they have been infected. Remember that some people are infected but never have signs and symptoms. A positive IgG antibody test means that you were infected with the virus in the past, but it doesn't tell us when you were infected. So if you have IgG antibodies in your blood, that could mean that you have some protection from future SARS coronavirus 2 infections. However, we don't know how long that protection will last, and we don't really know how good that protection is yet. So this is something that we're actively trying to learn more about. So to summarize again, there are two types of tests: a diagnostic test and a test to see if you had a past infection. The diagnostic test takes a sample from your respiratory tract. This figure shows a swab being collected from the back of the throat, going in through the nose. That will tell us whether or not there's viral RNA detectable in your respiratory tract, suggesting that you have an active infection. By the time you recover, you'll develop IgG antibodies. And if we take a sample of your blood, we can detect those and we can determine if you were infected in the past. Neither of these tests are perfect, but they're very useful tools for identifying people who have had disease and who are currently infected. Now let's talk about how SARS coronavirus 2 is transmitted between people. There are two main ways that SARS coronavirus 2 is transmitted between people that you need to remember. So as you know, infected people have the virus in their respiratory tract, in their mouths, noses, and throats. And there are droplets that come out of our nose and mouth when we're talking, laughing, coughing, sneezing, singing even. Sometimes you can see them, but sometimes they're so small that you don't really notice them, but they're there anyway. If someone is infected with SARS coronavirus 2, then those droplets that come out can have the virus in them. And then those droplets, if they land on someone else's face, in their mouth, nose, or eyes, can infect someone else. So if you are sitting close with someone, you're talking with them, you sneeze, you get a cough in the face. If you're sitting nearby someone, those droplets can travel far enough to infect you. The second way the virus is transmitted that you need to know about is through contact with surfaces that have viruses on them. So we just talked about how the virus is in respiratory droplets of people who are infected. So if those droplets get on surfaces or they're on the infected person's hands and that person touches a surface like a table or a doorknob, they can leave the virus on that surface. And then the virus can survive or stay on those surfaces, and it contaminates the hands of other people. Now, if you touch a surface that has the virus on it, and then your hands touch your mouth, nose, or eyes, the virus can infect you that way. That's why hand washing and cleaning are so important for preventing transmission, because many people can get infected through their hands. In hospitals, patients have procedures done that may increase transmission, but that's a specific setting. And we're really focused here in this lecture on transmission out in the community, so outside of the hospital setting. So as you already know, people who are infected with this virus will have infectious virus in their respiratory droplets. When you sneeze, cough, talk, or sing, those viruses and those droplets can travel up to 6 feet, which is a pretty long way. And those viruses could land in eyes, noses, or mouths of other people and infect them that way. Or as we already mentioned, they could land on surfaces. That's why mask use can be one way to reduce transmission. This is primarily to keep infectious droplets from contaminating the environment. So if someone who's infected is wearing a mask, then there are fewer infectious droplets that will come out from their mouth and nose. Wearing masks is a great way to prevent people from infecting others. Something to keep in mind is that SARS coronavirus 2 is transmitted very efficiently. So this virus transmits between people in ways that make it very difficult to detect and stop. People are infectious before they have symptoms, so they may be infecting others and not even know it. Some people never develop symptoms, and so they could also infect other people without knowing that they themselves are infected. So it's important for us to test symptomatic people and identify who they've had contact with quickly to try to limit the spread. This is done through contact tracing, and you'll hear more about this. So knowing how the disease is transmitted, it makes sense that transmission is more likely to occur the closer the contact you have with someone else. So people who have physical contact with a patient or have close contact are more likely to be infected. By close contact, we mean people who are within 6 feet of the patient for 15 minutes or more. Now, why 6 feet? Well, that's the distance that we know that those infectious respiratory droplets can travel. And 15 minutes means that you've been around them long enough so that you may have come into contact with some of those infectious droplets. So that's what we call a close contact. And close contacts may have never had actual physical contact with the patient, but they're close enough so that they could be at risk for transmission. People who share an environment with someone who's infected are at some risk for infection themselves. And an example of a shared environment is an office or even a restaurant if you're close enough to the person. Sharing food and bathrooms is another example of a shared environment where infection could be transmitted. And sharing a bed is another way that transmission could occur, again, because you're in close contact or physical contact with someone who has the disease. For all of these reasons, transmission is much more likely between people who live together because they're often having physical contact as well as sharing spaces. There are some living conditions that dramatically increase the risk for transmission. Sometimes we call these congregate housing settings, and it means essentially when there are many people living in very close quarters. Prisons and jails are examples of congregate housing, as are group homes, dormitories, as like at schools, or shelters. These places are all high risk for very quick spread of the infection because people are living close together and sharing spaces. When we think about risk for transmission, nursing homes really represent a worst case scenario for COVID-19. This is because you have, of course, people living in close quarters together who may have frequent contact with each other, but they also represent a group of people who are at very high risk for severe disease because of older age, multiple underlying health conditions that put them at increased risk for severe disease. They may need multiple interventions, such as feeding and toileting, so they're having very close contact with caregivers. Staff are at increased risk because of this, because they're having such close contact with patients. And importantly, nursing homes aren't hospitals, so they're not well equipped to take care of people who develop severe infections from COVID-19. So nursing homes are a place where transmission can happen very quickly, and people will be at high risk for infection. And if they are infected, the health consequences are severe. So these really are worst case scenarios for outbreaks of COVID-19. COVID-19 is a new disease, and so stopping transmission really is the best way we have to mitigate the impact of this pandemic. Let's review again what happens when someone is infected. They develop signs and symptoms of disease, usually about 5 days after they're infected, but up to 14 days after their infection. And then they themselves are able to infect others 2 days before they get sick, particularly on the day that they get sick. And they're still able to infect people as long as they have signs and symptoms, which is at least 10 days. So let's imagine that they have contact with someone else on the day that they're sick, really as they begin to feel ill. That person, let's assume, will have a 5-day incubation period. So after they're infected, they will develop signs and symptoms 5 days later. Here you can see that after they develop signs and symptoms, they'll have disease for 10 days. We can also see in the yellow highlighted area here when they are infectious. So you can see that they are infectious 2 days before they become ill, which is really only 3 days after they were infected. So if we want to interrupt transmission, if we want to stop transmission of COVID-19, we have to find people who have been infected. We have to limit the number of people that they have contact with so that the transmission chain won't keep going. But you can see in this schematic why that's very difficult to do, because very quickly after their infection, they will themselves become infectious and able to transmit to other people. So that means that, as you can see here, the window of opportunity for us to act and find those people who've been exposed, find the people who are infected but aren't sick yet, and ask them to change their behavior, to limit their contact with other people, to stop the transmission. That window of opportunity is very short. It happens very quickly. So our public health systems have to respond very quickly when we find cases of COVID-19 and try to find everybody who's been exposed to those cases, that we can take some action and stop transmission. Next, I want to introduce you to another concept called the reproductive number. You may also hear it referred to as R-Naught. The reproductive number is the number of people that one infectious person will go on to infect if everyone they have contact with is susceptible to the disease. It's a good way to think about how fast a disease can spread in the population. And the higher the reproductive number, the more people who will be infected over the course of any outbreak. You can see in this figure some important numbers for R-Naught and how the number of infected people would change over time depending on what the reproductive number is. So in the blue line, you can see what the number of infected people looks like if the reproductive number is 1. If the reproductive number is 1, this means that every infected person infects just one other person. So over time, the number of infected people will not change. It will stay constant. Now, what happens if the reproductive number is less than 1? That's what's shown in the purple line here. So over time, if each person infects less than one person, so sometimes an infected person will infect someone else, but sometimes infected people won't infect anyone at all. And on average, it's less than one person. Over time, the total number of infected people will come down. What happens if the reproductive number is 2? So that means each infected person will infect 2 other people. That line is shown in red here, and we can see that if the reproductive number is 2, the number of infected people will increase very quickly over time. Although typically we think about the difference between 1 and 2 as not being very much, the difference between a reproductive number of 1 and a reproductive number of 2 is huge in terms of the number of people who will ultimately be infected. So everything we can do to try to get the reproductive number closer to 1 will help us control the spread of a disease. So what is the reproductive number for SARS coronavirus 2? Or to say it another way, on average, how many other people will one person infected with this virus infect? Let's look at some examples. So here in this figure, you can see that there's an infected person represented by a purple dot in the middle, and there are gray dots all around. Those represent the close contacts of this infected person. Measles is another virus that you may have heard of before. Measles is one of the most infectious viruses that we know of. The reproductive number for measles is 15. That means that each person with measles can infect up to 15 other close contacts, as you can see in this figure. It's very infectious. In this figure, we're looking at MERS, or Middle Eastern Respiratory Syndrome. That's another type of coronavirus. MERS is not very infectious. On average, each infected person, which is shown here in the purple dot, will infect less than one other person. You can see that in the dot just above that's partially covered in red. So MERS usually doesn't cause very large outbreaks because on average, each case will only infect one other person or less. Now let's look at the reproductive number of COVID-19. On average, each person with COVID-19 will infect 2 to 3 other people. And you can see that represented here. There are 2.5 close contact dots that are covered in red, showing that those are the people who are going to be infected. This reproductive number of 2 to 3 is very similar to the reproductive number for influenza virus. And you can see that here for comparison. People infected with influenza virus, on average, will infect 2 to 3 other people if everyone they have contact with is susceptible. So a reproductive number of 2 may sound small, but even a reproductive number of 2 can create a large outbreak. If each infected person infects just 2 other people, the size of the outbreak doubles quickly, as you can see in the figure on the slide. If we can prevent just 1 infection so that each person infects only 1 person instead of 2, we can have a big reduction in the number of cases over time. So you can see on this figure, if the first person infects only 1 person, and that person infects only 1 person, and that person infects only 1 person, you end up with only 4 cases in this outbreak instead of the 15 that would have otherwise occurred if you hadn't have stopped some transmission. Just because you can't stop all transmission doesn't mean that you can't have a big impact on slowing down the outbreak.